Thank you, and thank you for having me on this program. The down button, right? Yeah. So I'm going to focus on the idea of inserting a program into a setting rather than reforming the setting, like Bob just talked about. And there's many examples of the kinds of programs, including school-based programs, that fit that idea. And we've heard about some of them this morning, including life skills training and Abaniya, and then some even broader, more positive programs like positive action that Bob Granger mentioned I now work with. So what magnitude of effects first of all, what magnitudes of effects can we expect when inserting a evidence-based program into a setting? And I briefly mentioned earlier today from the back there about the efficacy trials and what they mean to university-based researchers. So that's a test of a concept under ideal conditions, or as ideal as you can get them, whereas effectiveness trials are tests of the effectiveness of the program under more real-world conditions. And the reality is that for most school-based programs, including Abaniya, my Abaniya study, and positive action, they're sort of partway along between those two endpoints. That's really a continuum. It's not one or the other. It's a continuum, and you can be anywhere along that continuum. And meta-analyses, and thanks Mark Lipsey here for three references, one with personal communication from a few days ago. Meta-analyses suggest that the effects of programs evaluated under real-world conditions are generally smaller than when those same programs are evaluated under more controlled conditions. And his statement to me in an email is right there. And then in a couple of his papers, basically the effect size in what he called demonstration programs, more efficacy trials conditions, are practically double or more than double the effect sizes under real-world conditions or routine practice conditions. So that's worth keeping in mind, that any replication of an evidence-based program where the evidence is based just on efficacy trials, we can expect smaller effects just because of the differences between those settings. Why does it occur? Well, efficacy trials are often conducted by the same people who develop the programs, university professors like me, and we maintain a high level of control not only over the trial, but over the intervention delivery. Okay? And so we ensure a high level of delivery and integrity and so forth. But we're not good at sustaining a program, as you heard from Amy earlier today. Effectiveness trials, on the other hand, are more likely to be conducted by third parties who have less control over program implementation and possibly also lower motivation to ensure program integrity. And that gets at something that Abe and I were talking about earlier this morning about why is it that some of these big national evaluations show no effects for programs that were evidence-based until they got into the national evaluation. This is part of the reason. Can this be changed? Can we get evidence-based programs to produce effects as good or close to as good as in the earlier trials? Probably, by ensuring some optimum implementation. And what are the conditions for getting that optimal implementation? Most of them are the same as the kinds of things that Bob Slavin has talked about both here and in his papers, and Abe has also in his papers. Support of the whole setting. Being true to the model. That was talked about a lot this morning. Investment in the program. So schools that pay for the program will do it better than those who don't. It's one measure of people who want to do it are more likely to do it and do it well. And ongoing professional development, which has been talked about also. And in another condition, which I think is a little different, Bob's program, the settings goals are automatically aligned with the goals of his program, or said the other way, the goals of his programs are automatically aligned with the goals of the settings that he's trying to change. And that's not always the case with programs we insert into settings. So drug abuse prevention programs, their goals are not necessarily aligned with they're certainly not aligned with the broader goals of the school, which is academic achievement, is the highest one, right? Even more so in the last 10 years. And, blocking on his name, the ex-director of Safe and Drug-Free Schools, was always telling us prevention researchers, you've got to show that you can improve academic achievement or your funding's going to disappear. Well, guess what, right? Safe and Drug-Free School no longer exists. So the support of the whole system, now just to elaborate on each of those points a little. Readiness for change, Karen talked about that, and other people are talking about it. The leadership, we need an ongoing champion in the setting. So in the school, it's the principal, better than a designate of the principal, the actual principal. If the principal champions something, it's more likely to get implemented properly and more likely to be effective. The implementers themselves, and they need to be able to do a team effort to ensure our most optimum implementation. The recipients of the intervention, the students in a school-based setting, and their families need to have buy-in. And there's also, and this covers across multiple people, a need for quick and easily observable improvements or successes. The quick success is a good way of ensuring ongoing good implementation and improved implementation. Early failures, it's the opposite. That they're more likely to say, well, this isn't working, let's just forget it. Investment is essential. Settings that pay for the program and training usually implement better. Continuous investment is necessary. Refreshing the consumable materials, ongoing technical support and training obviously is better than not having that, and it's also needed in settings. Most of our human service settings, including schools, have high staff turnover. And so one round of training ain't going to do the job, because next year you have half the people are new and they haven't received the training. But even for the people who are still there, they need retraining. It's like a booster session for any other kind of learning. We don't learn stuff one shot. Even if we learn it and then do it for a year, it's still better to have another round of training, get more up to speed, get realigned perhaps if you've drifted, and so forth. Continuous purchase of support and training from the program developers is also helpful, and this relates to other people's points from today. Homegrown or third-party materials or training are usually inferior and likely to be less effective. Being true to the model, integrity with the original theory and key concepts of the program must be maintained if new settings and places are to obtain the same kinds of results as found in prior evaluations. And we had lots of discussion about that in the earlier session. Adaptation for the culture or context can be useful, and we had lots of discussion about that point here too, with Felipe's and the other presentations earlier. The intensity, breadth, comprehensiveness, etc. of the original program have to be maintained, and Sharon gave us a lot on that, even more when I asked her a pointed question. No, there's no shortcuts. If you want to make a change, you need the evidence, and or if they're going to try something new, they've got to evaluate it. And so this funding mechanism where they can try out new things is a good idea too. Ongoing professional development, not only the initial training, which of course is essential, but ongoing. And I totally agree with Bob that the train-the-trainer model probably does not work under most settings, and I found some literature to support that statement. And you see the references there. The effect sizes are cut in half with train-the-trainer model. Expert training is more costly but also more cost-effective because of this. Okay, so it's more cost-effective still, despite it being more costly. Ongoing training, annual retraining, and I'm getting anxious about my plane. And the big thing that's a bit different from Bob's, I think, is that alignment with the overarching goals of the setting. And in a way, this condition underlies all of the others. To the extent that this one is true, the others should follow, right? If you're totally aligned with the overarching goals of the setting, then they're going to have buy-in and all those other things that I mentioned are more likely to follow. And this must become legitimate at all levels of the system, linking the prevention program outcomes to academic achievement, for example. And you can't just claim it, you have to be able to show evidence for it, okay? And so drug abuse prevention or after-school programs or social emotional programs, if they want to demonstrate that they can improve academic achievement, if they want to claim that they can improve academic achievement, they have to be able to show it with their own program, not just drawing on other research. And they need to quickly produce easy-to-see and desired effects that are aligned with the goals of the school. So quick changes in the atmosphere of classrooms, for example, in classroom management would be a good indicator of that, which should then be followed by more time on task learning and improved learning and so forth. And also need to meet the broader overarching goals of the broader setting, addressing the whole child and the family and the community as well. So just to summarize, inserting a program in a setting requires the same sorts of conditions as Bob talked about and other people have talked about, plus this additional one of this alignment with the overarching goals of the setting. The references are listed here in your paper, and I thank the organizers, and I also thank my wife, the developer of Positive Action, for her input into this. Thank you.